My name is Ana Castro. I'm a nephrology resident at Centro Hospitalar do Porto, Portugal, and I also collaborate with the Grupo de Estudos Vasculares. Today I'm bringing here a study made by us entitled Doppler ultrassonography role in significant stenosis definition. So, arteriovenous fistulas are the preferred vascular access in hemodialysis patients. Stenosis and thrombosis are the major causes of loss of vascular access patency. International guidelines recommend surveillance for their early detection and correction. And unnecessary interventions traumatize vessel wall, which in turn accelerates restenosis. The definitions, however, the definition of significant stenosis varies among centers and remains controversial. So, we performed a 4-year prospective study that was developed between 2011 and 2015 to evaluate arteriovenous fistulas who were referred to a vascular access center with possible stenosis. Whole accesses were studied with duplex ultrassonography, and our criteria for significant stenosis were a resistance index in the feeding artery higher than 0.7, a residual diameter lower than 2 millimeters, and a Ka lower than 500 milliliters per minute, or a Ka decrease higher than 25% for a 30 days period. The indications for the referentiation to our center were stenosis in 55.5%, a Ka reduction in 30.3% of the cases, a Kb reduction, difficult cannulation, or reduction of dialysis dose or recirculation. Other motives such as edema or increase of hemostasis was also some of the criteria. During the fourth year period, we evaluated 260 arteriovenous fistulas. According to our criteria, no significant stenosis was present in 38% of the cases. Significant stenosis in 35%, no dysfunctional access in 21%, and we also saw other complications which were responsible for 60% of the cases. I think it's not working. During the fourth year, we saw that no significant stenosis evolved to significant stenosis during a follow-up period of 308 days. We have one case of thrombosis that we saw at 537 days. With the group of significant stenosis, we treated a total of 131 patients. From the group of no dysfunctional access, there was thrombosis in a period of 584 days. When you compare the cumulative survival of the significant stenosis with non-significant stenosis, we constated the survival was lower in the group of the treated stenosis. And it was 91% at the first year, 88% at the second year, and 91% at the fourth year, comparing it 97% at the fourth year in the group of the treated stenosis. So, according with our criteria, we can say that the vascular access monitoring and surveillance in conjunction with resistance index in the feeding artery higher than 0.7, the residual diameter of the stenosis lower than 2 millimeters, and the Ka lower than 500 millimeters per minute, or a Ka decrease superior to 25% for 30 days period, evaluated by Doppler ultrassonography, appear to be appropriate and safe criteria for therapeutic referral. And duplex ultrasonography is essential to evaluate dysfunctional vascular access, and it must be used before angiography and/or surgery.